The first thing that we are going to do is check the medical record for physician orders, the type of nasogastric tube to be placed, and the tube's purpose. And then we're going to review the client's history for any conditions that would impair the NG tube going in. We're going to assess the client's level of consciousness, ability to cooperate, and their ability to move in the correct position for the placement. And now we're going to assess the client's nares and oral cavity. We're going to look for any deviated nasal septum, nasal surgery, inability to breathe well, and when either nasal opening is occluded or irritation and bleeding. And we're going to assess again their ability to cooperate. Next, we're going to wash our hands, and we're going to confirm the patient's identity using 2 patient identifiers. We're going to ask for their name and date of birth and explain what we're about to do for the client. Then I'm going to apply a pair of clean gloves and prepare our supplies. So the first thing to do to prepare is to measure the estimated length of the tube that will reach well into the stomach. To do that, we're going to measure from the tip of the nose to the ear to the xiphoid process. So that will be from here to here to here. So we're going to put a piece of tape at the 40 mark to mark our spot. Now we're going to lubricate 4 inches of the distal end of the NG tube with a water-soluble lubricant. We would also place a towel on the patient's chest. We're going to tell the client insertion is about to begin and ask them to extend their head back against the pillow. At this point, our patient would be in the high Fowler's position. We're going to insert the tube slowly through the nares and curved end pointing downward towards the ears. If resistance is met, we're going to apply gentle pressure downward and advance the tubing. Along the way, we're going to check the back of the throat for coiling of tube with a pen light. We're going to insert until we reach our desired spot. We're going to ask the client to bend their head forward, chin to chest, and swallow with or without water as allowed and advance the tube with each swallow. If gagging or coughing occurs, we're going to withdraw the tube a little and allow the client to rest and continue again to advance. We're going to advance with swallowing the tube until tape marker has been reached. We're going to temporarily tape the tube to their cheek. And we are going to then check the placement of the tube. We're going to ask the client to speak. We're going to inspect the posterior pharynx for presence of coiled tube. We're going to attach the catheter tip syringe at the end of the tube and aspirate gently back on the syringe to obtain gastric contents and observe the color. If hospital policy, we're going to test the pH of the aspirated contents. And we're going to re-inject the aspirate or air bolus and listen with a stethoscope over the gastric area for swishing sound. And then we're going to measure the amount of exposed tubing from the nose to the tube and compare with the baseline. Next, we're going to anchor our tube to the nose. Doing that, we're going to cut our tube in a Y formation and anchor it to the nose. like so. Now then we would fasten a rubber band to the end of the NG tube in a slip knot and pin the rubber band to the client's gown, allowing for enough slack for the movement of the head. We're going to keep the head of bed elevated to at least 30 degrees unless otherwise ordered. And we're going to attach the NG tube suction to the suction source and establish a suction at low intermittent setting unless otherwise ordered. We're going to provide oral hygiene every 2 to 3 hours. And finally, we're going to assess the patient's comfort level. We're going to document the procedure and the outcomes. We're going to remove our gloves, place the call light next to the patient's bed, wash our hands, and that is it.